Okay. Hi, everybody. This is Dr. Anvar with Skilled Physicians Group and Skilled Wound Care on another podcast. I'm here with Henry Okonkwo, our Chief Medical Officer, Clinical Officer, with our group, who we're always happy to be talking to. And today we're going to be talking about some health tips with what's going on around the world today. So, Henry, welcome back on the podcast. How you doing?
I'm doing fantastic. Thank you very much for having me today. I'm excited to be here.
Okay, well, thanks again. And I know you're mostly usually on the podcast, so
yeah, I know.
So let's get into it. I know you've been talking to a lot of people about how to get through these tough times with everything that's going on with health and healthcare these days, and you had some really great tips. I know you have your special 8 things that you like to talk about, so I thought it might be good to share with everybody what those 8 things are to do to kind of keep yourself from worrying and just staying sane. So I'll let you describe your 8 topics.
Thank you so much, Dr. Anvar. Yeah, I'm really excited about sharing it. Since this pandemic began, I think one of the things that's been so understated for everyone and involved is especially healthcare workers and their families and those that are suffering from COVID are the emotional distress that comes along with either having a family member who may have experienced a COVID infection, or being a healthcare provider and you're managing a patient or trying to manage patients that have been infected by the virus, or just being away from your family and them having to deal with the turmoil of you not being around or just being afraid that you may get infected. All of those things create a tremendous amount of emotional distress on you as a healthcare provider, on the families of the healthcare provider, on your friends, and just everyone around you. I think it's been really understated, the level of emotional distress that COVID has created within all of our communities around the United States and around the world. It's something that's on your mind 24 hours a day. And whether you're directly impacted by it or just it's in your environment, meaning it's on the news, it's everywhere you walk, you see people with masks on, the level of fear and stress that's created by it can be really tremendous and can wear you down. It's not normal to walk around with this level of anxiety or worry or distress. And if you don't check it early enough, it can really, really create long-term negative impacts on your entire, health system. Internally and even externally. And so I thought it was really important for us to just take 5 minutes and talk about what are some things you can do to sort of combat what I like to call, unfortunately, COVID stress or COVID depression or PTSD secondary to COVID, because everyone is experiencing it in different ways, whether it's just through the apprehension of just knowing that the virus still is as impactful and as deadly as it is to this very day, or because you've already experienced it firsthand or had family members who've actually been, infected by the virus. And so these 8 tips, hopefully you'll find them helpful and you'll find them something that you can implement right away in your life and then practice it daily, because it really does take that level of effort to try to undo some of the damage that's already been done over these past 6 months as we've been dealing with COVID, around the world. And so let's start by talking about tip number 1, or step number 1, I like to call it, as for your action plan for reducing stress associated with COVID. And number 1 is to really stay away from negative thoughts and negative words. You have no idea the level of mental impact that always hearing negative information from other people or from your phone or from your television or from your radio, it will eventually have on your life and on your being. You know, humans thrive on positivity and hearing positive news. It keeps us motivated and keeps us moving and keeps our entire system moving in the right direction. When every day you are constantly berated with negative news or negative information, it will wear you down, whether you know it or not, and it will start to impact everything in your life, from the way you eat, the way you think, your activity and energy level. And so staying away from negative thoughts in a very mindful way, literally being aware that, hey, this is negative, I don't need to hear this now, and just keeping your distance from it, and then also avoiding using it yourself is a big deal. That way, you're not repeating it. You're not a perpetrator of it. And so a lot of times we'll hear it, and then without realizing it, we pass that same negative energy on to someone else. And so it's really important to follow that tip number one. And then tip number two, give yourself a TV and a phone and internet timeout. You have to give yourself timeout away from this constant level of information that's coming your way about COVID. I know some people even have COVID tickers where they're having constant ticker updates on how many people are positive in what parts of the world or what parts of the U.S., how many people died today. Yes, not that all of that information is not important, because it is. We value every single life, and we want to make sure that every single life is respected. But the level of intimacy and interaction with that information on a daily basis can wear you down without you realizing it. It puts it at the forefront of your brain, and then it ultimately dictates every action that you take for the rest of the day until you go to sleep. And then it becomes part of your subconscious, which eventually then continues to wear down at you internally, which can ultimately make you sick. It can compromise your immune system and predispose you to even becoming infected with COVID, simply because you're so immunocompromised from just fear, lack of eating, lack of taking good care of yourself and your health, and having that very high stress level with high cortisol levels just sort of going through your body. So please do your best to give yourself a TV, a phone, and a media timeout where you're off the internet, you turn off your television set, and then when you have it on, don't have on anything that has to do with COVID. When you're on your phone, turn off that ticker and just, reach out to friends, have a great, loving and fun and happy conversation full of laughs. And not that you're ignoring the things that are going on in the world, but you don't make that the primary source of your day-to-day conversation. That's really important. And you're doing it for your own good health. So please take on that step number two. It's critical to your health and to improving your overall health. Then number three, get plenty of rest. Rest is essential to life. It's your time for you to recover from all of the stress that your body has endured throughout the day. And it's important to allow you to heal from injuries that you even that you may have occurred to you throughout the day. And that can be physical injury or mental or psychological injury. And so if you continue to keep an elevated level of stress, it will affect your sleep. You're not going to get that good 8+ hours worth of sleep every day. And then your ability to recover and to heal from all of the challenges that your body endures throughout the day becomes compromised, which over time will start to build in a negative way and completely can compromise your entire immune system and leave you very vulnerable to getting sick. So please give yourself plenty of rest. Along with plenty of rest, give yourself plenty of hydration. COVID or no COVID, we know that hydration and getting an ample amount of water every day is really important to overall health and balance. A lot of times when we are stressed, we stop doing the things that we normally do. And intake of water is one of them. You'll find that you don't drink as much water anymore just because your mind is busy worrying. And so reminding yourself to hydrate, getting in a goal of 2 liters every day is really important to your overall health. So please continue to make sure that you're attentive to your hydration levels and continue to elevate them and keep them appropriate as much as possible. Then next, number 5. Number 5 is really giving yourself a boost of the right vitamins. Even though, I'm always checking when I'm in the grocery stores or inside the pharmacies for the availability of zinc and also the availability of vitamin C. So the moment you can get your hands on it, make sure you purchase yourself a couple of bottles of zinc, a couple of bottles of vitamin C, and make sure that you're taking, at least 1 tablet of zinc a day and 2 tablets of 500 milligrams of vitamin C a day, and take it in divided doses, 1 in the morning, 1 in the evening of the vitamin C. And that way you're getting 1,000 milligrams a day of vitamin C and 1 220 milligram tablet of zinc every day. This is great for your immune system. It really helps to boost it. It helps to, continue to help to improve your defense mechanism in this time when stress can make your immune system very compromised and vulnerable. Having these 2 minerals on board, or these 2 vitamins on board, can be very helpful in boosting your immune system and giving you the extra support you need to defend yourself from any type of infection, which also includes, obviously COVID. And because as we worry about COVID, you can also still develop other types of infections. The flu season is about to come upon us, and that's going to be a major problem. So keeping your defense system up and strong as possible is going to be really critical to getting through the remainder of the year and into next year in the most healthiest state as possible. And then this leads us to number 6. Number 6 is really boosting your overall immune system by having a good nutritional and balanced diet. So as you're taking the supplements, that's great, but it's not enough. You want to make sure that you're also having a good, well-balanced nutritional diet every day, and that you're getting enough calories to make sure that you can support your energy level that's required to get you through the day. Having a nice balanced diet that has, vegetables, getting your protein in, and then just enough carbs, not too much, but not too little. That way you can have a good, strong immune boosting day, and it can be extremely helpful in fending off, an easy opportunity to catch an infection. So that's really important as well when you're trying to take care of yourself. You want to make sure that mentally you're equipped and physically that you're equipped for any day and what the day has to offer. And then next, number 7. Number 7 is being able to think positively. It's so important that not only are you turning yourself away from the negative words and the negative energies that might be coming your way, but you're also presenting yourself and always thinking in a very positive manner. COVID has created a gloom and doom sort of thought process for everyone, for a lot of people. And, you want to remove yourself from that community and really just shift your mind, make that mental shift to positivity and embrace a more positive thought process where you believe, number 1, that this is not going to last forever. Number 2, that you're going to be okay. Your family's going to be okay. The world is going to be okay, along with your community. So you want to make sure that you continue to think positive. It's extremely important. Don't walk around with this doom and gloom, sky is falling kind of personality. You want to make sure that you really believe that better times are ahead and that this is not forever. So really, really important. And then lastly, number 8, share number 1 through 7 with everyone around you and everyone you know. The best thing you can always do for anyone that you care about or that you love or just people you see that you come in contact with is share positive energy, positive thoughts, positive words, and good information that can help them make their lives better. And so that's number 8. Share what you've learned today in this podcast presentation, and and live it. So live it and share it and be an example for it. You will find that as you give positive energy, others will give it back to you, and it becomes contagious, and we're all giving it to each other. And then people will be a lot happier, be healthier mentally and physically, and get through this COVID crisis, or pandemic rather, as quickly as possible, as healthy as possible. And that concludes our 8 steps, our actions against reducing COVID stress.
Very good. Thank you, Henry. Those are some great tips. A lot of mind-body awareness. Not only do we want to work on our mental health, but also our physical health. So as Henry so eloquently put in his topics, is that we want to keep our mind focused on the positive, and we also want to keep our body health focused on nutrition and hydration and getting enough sleep and things of that nature. And so, Henry, how are things with patients these days in COVID? What are you seeing out there?
Well, the interesting part is, unfortunately, for patients in the skilled nursing facility, when COVID first hit, one of the major problems were the facilities went into a complete lockdown in an attempt to obviously try to protect their residents from exposure to the virus, limiting, contact with the public and the external, anyone outside of the nursing home environment, including family members. And so this unfortunately had a negative side effect on a lot of patients, where even though we did lose quite a bit of patients to the infection, but there was quite a bit of patients who unfortunately suffered their own version of COVID depression or COVID stress, because that's all that was going on in the facility. The nursing homes, that they were trying to implement new infection control protocols and keep their patients safe. Patients, unfortunately, were now being isolated. They were, on their own. And when they were seeing the nurses, they were no longer seeing their faces. They were seeing only them with masks, which made them afraid and very concerned. And, when the TV was on, it was all about, who died and how many died. And so that started really to develop a really negative, unfortunately, a negative outcome on patients, where patients over time started to get depressed, slowly stopped eating, and started to then suffer their own version of COVID-based, depression or post-traumatic stress syndrome from, loved ones or people that they're actually in the nursing home with that had succumbed to the infection and that had passed, along with the fact that their family members were no longer allowed into the nursing home. So the human touch of your family hugging you or sharing time with you all disappeared, in a quick, rapid minute. And this created even more stress for residents in the skilled nursing facility. So it really had been a really dark time for residents. And one of the things that we've done in our practice is continue to train our doctors to be positive and to encourage the nurses to also have a much more positive perspective and to take a more happy, energetic approach to managing patients, and, use encouraging and positive words, as well as, give them a little bit of human touch that they can't get from their family members who aren't around. So that way they can at least feel that things are getting better for them. Because if not, there would be no way to undo some of the damage that had been done during the early parts of the crises. So, but we are seeing more positive things now because, obviously the nursing homes have really done a great job at getting their infection control protocols in place and keeping residents a lot safer. allowing for a little bit more interaction between them and the staff because people are being tested, much, much more often, and everyone feels safer and much more comfortable. And now they're interacting, new things to help bring a little bit more normality, for lack of a better word, into the nursing home, where at least they feel that it's not so much gloom and doom as it was at the beginning of the crises. Unfortunately, family members are still not allowed in. But one of the things which we've always recommended with our nursing home partners is having dedicated iPads or phones that they can use to do Zoom conference calls with their family members or Skype with their family members. And that way they can still see them and say hello and smile and laugh and feel that that they still have their loved ones around, along with doing window visits with their loved ones. That's something that nursing homes have done a great job at implementing in an effort to make sure that family members don't feel alone or lonely or without any loved ones around anymore. So things are getting better, and they continue to get better. We're continuing to encourage all the positive actions and activities we can within our facilities and also with our residents that we're managing and taking care of. So we are excited about that, and we're seeing less negative outcomes and finally seeing much, much more positive outcomes with residents in the skilled nursing facility.
Well, it's good news that we're seeing the tides change in the nursing facility. What are your thoughts and opinions on the COVID vaccine when it comes out? What are we going to see happening? Would you take it? Do you think it's going to be mandatory for healthcare workers, especially in the nursing facility and patients?
Yeah, that's a great question. The production and the level of effort worldwide that's been put into vaccine development is tremendous and very impressive. The level of approach that a lot of the different companies are taking to try to develop a vaccine that will be safe and that people will be willing to take. And, there was a recent poll of sort of an opinion poll asking people, would they take the vaccine the moment it becomes available? And the irony is almost a 30-30-30, sort of one-third breakdown. And that 1/3 of the population is like, yes, I'm ready to, I'll be the first in line. The other third of the population is like, absolutely not, I won't touch it. And then another third of the population is, well, I would like to take it, but I'd like to wait and see how other people respond to it. And I think that's going to be one of the biggest challenges the moment a vaccine is available, is encouraging and educating the population to go forth and use it. Now, with healthcare providers, I do think just like certain vaccinations are required to manage patients or to have access to be a healthcare provider and take care of patients, especially in the hospital setting, we most likely will be required to get vaccinated in order to continue to manage our patients. I do anticipate that coming down the pipeline. I don't know if it'll be immediately, but it may just be encouraged in the beginning, and then maybe legislation may mandate that. I think time will tell. But in spite of that, I am excited that we are going to have vaccines that are available, and hopefully, the top 3 variations that are coming out will, prove to be, very effective and give everyone the confidence to get vaccinated. And so we can continue to progress towards an opportunity where the world is more back to normal, whatever the new normal will be. I don't know if it'll ever be what it was before, but I know we'll definitely have a much, something close to a new normal as vaccinations are made available.
Yeah, I mean, my personal take on it is that we see the flu vaccine coming out in a different variation every year. Mm-hmm. It's a quadrivalent, which is actually to prevent getting the flu for 4 different strains of the flu. A lot of people take the flu vaccine, myself included, and still end up getting the flu because the flu obviously mutates. And we don't really know, also with COVID, if you get the COVID vaccine, the COVID may mutate. And you could still get a mild form of it. But overall, I would say vaccine development has been around for a long time. The way we develop vaccines is much more sophisticated than we used to do it maybe 50 years ago when the Salk vaccine came and other vaccines came out and there were issues with manufacturing. We now know how to manufacture them and keeping them safe. I don't think safety is probably the issue. I think the issue is, does the vaccine actually work is going to be the main question with this vaccine. We'll have to see. But there's been a lot of trials and testing going on right now throughout the world and in the United States to really not only to test safety, but efficacy. Does it actually work? And we're getting some promising results. My belief is definitely in healthcare. It's probably going to be mandated. Anybody working in healthcare and going into facilities, hospitals, clinics will have to take the vaccine. And we may see that even in society at large, if people want to be able to easily go to businesses and travel, that there may be some mandates on, are you vaccinated or not? Because I think it's hard to get information from people as to whether or not they've been COVID positive. And there is some questions, even if you've been positive, whether or not you're immune to the disease. So I really think as a physician, I'm not worried about dangers from the vaccine. I think the only real question is, does it actually work? But we do know that the more people that get vaccinated, we're going to eliminate more of the disease from spreading and therefore creating a lot safer of an environment, both in healthcare and out in the public. So I think hopefully that'll be out soon, and I think that will give everybody a wide sense of relief. I do know that there is probably 30 to 50% of people who are skeptical about it, but once it comes out and people are using it, I think the tides will turn. This will be something that a lot of people will be excited to see out in the marketplace.
Yeah, I completely agree with you. Do you think, at least for as people start trying to get back to some kind of normal work environment, that employers may require sort of a COVID card, a COVID vaccination card, so to speak, do you think that's something that might be required as employers start to try to get their workers to show up?
Yeah, I think that's a great question. And I think that begs the question of who's going to be keeping track of employees' health. And so right now, I think if employees have medical problems, generally they go out and they see their physician. And now we're going to be seeing healthcare being involved more and more in the workplace. You can imagine a restaurant wanting all their servers to have been vaccinated and having to have an outside healthcare group coming in and ensuring everybody is vaccinated and, yes, provide clearance for all their workers. So, yeah, I agree with you. I don't know if it's going to be some sort of identification card, but I do think there will be some kind of clearance given by an outside party, a healthcare group that will probably give some sort of blessing.
Yeah, I that's been on my mind as something that we may see in our new, sort of I'm calling it our new normal. How do people feel comfortable knowing that, your coworker, are they vaccinated? Are they not vaccinated? Are they COVID free? Are they not? In an attempt to try to create an environment where we're not obviously always wearing masks all the time, unless at least, mandatory. So that is something that I've thought about. So I did want to hear your opinion on that.
You could imagine that people would want all of their servers and everybody vaccinated when they go out to a restaurant.
Of course, yeah.
If even if it's not required by the government, I mean, would you rather go to a restaurant where everybody's vaccinated or not vaccinated, and then, people are handling your food and coming to your table? You'll probably, most businesses will probably go towards that, unless they're a business that maybe is still work from home and they've adapted that model, and then they're just like, okay, well, we're not interacting, so we don't need to worry about it. But I think any businesses where people are interacting with each other, I think that's going to be a big question.
Yeah, I totally agree. I do think that, whether fortunately or unfortunately, that I think that's going to be the future, because to get to a level of interaction to the level that we were in before, there has to be something where people feel that I know that I'm safe. I know the person next to me is safe. And, that creates some level of accountability or insurance that, everyone's doing their best to protect those around them. Because you think about sporting events, all the things that we used to normally do and in very close proximity to each other, reestablishing that will take some level of coordination and transparency.
Well, I don't think, you can probably get a bunch of people coming to a sporting event, making sure that they've all been vaccinated. That would probably be a violation of some sort of rights to go to a public event. But, you could possibly, if you're like a grocery store, you would want all the people working at the grocery and vaccinated so that they're safe in case somebody comes into the grocery store who is positive. And then, when you go to public places, I guess you're taking a risk, but maybe many people, when they go to their place of work, they want to know that it's safe and everybody's vaccinated. So that's going to be an interesting thing. We'll see how people go about it and what the governments do. And we know that there's local, state, and federal government and the CDC involved. Everybody has a different opinion on things, because we know that if you ask four doctors how to do something, you might get four different answers. So same things happen.
Exactly.
So a lot of opinion out there that isn't fact, and when you have something that there isn't enough information about, a lot of opinions become, facts, which we don't like.
Yeah, become facts, which we don't like. Very true. Very true. Very true.
Yeah. Well, thank you for your health tips, Henry. We really appreciate it. Thank you for everybody for tuning in. And any final thoughts?
Well, thank you for those that are listening in. We definitely appreciate your time and your commitment to listening to our podcast rather. And just, I guess, final tip is stay healthy, stay positive, exercise, take really good care of yourself, and maintain a positive attitude at all times. We as human beings will always persevere through the most challenging times. And so I'm very confident that with every day, we'll only get smarter from the experiences we've had in the past and do better with the knowledge that we gain. So continue to think forward and live forward and be positive. Take good care of yourself, everyone.
Okay. Thank you, Henry. Thank you, everybody. And we'll hear you on the next podcast.
Exactly.
Bye-bye.
Looking forward to it. Take care. Bye-bye.